Higgins.
Thank you. United States healthcare costs were $3.65 trillion last year. It's over $11,000 per person. Annual increases are 5.5%. Our colleagues on the other side have been emphatic in their support for protecting people with pre-existing conditions. But prior to the Affordable Care Act, if you had a kid that was stuck with childhood cancer, an insurance company could deny you coverage because it's a pre-existing condition. You can't do that anymore because it's against the law. And there's only one federal law that provides protection for people with pre-existing conditions, and it's the Affordable Care Act. So if you vote to repeal it 70 times, you do not support protecting people with pre-existing conditions. If you join a lawsuit to challenge the Affordable Care Act in a Texas appeals court to deem unconstitutional the pre-existing conditions mandate, you do not support protecting people with pre-existing conditions. Rebecca Wood, you provided compelling and courageous testimony today. You said that when Charlie was 3 months old, she was well enough to come home. Issues from her premature birth appeared one after another. Each one required treatments and therapies. Her birth was a pre-existing condition. 130 million Americans have pre-existing conditions. 51% of the non-elderly population has at least one pre-existing condition. 75% of people between the ages of 45 and 54 have a pre-existing condition. 84% between the ages of 55 and 64 have a pre-existing condition. The good thing is those over the age of 65 don't have to worry about it because Medicare always covered pre-existing conditions. There are a lot of good proposals out there. But the bottom line here is we have an obligation on behalf of the American people to use the leverage and the quality of the Medicare program. Virtually universal access. You know, I often hear docs in hospitals bellyache about Medicare reimbursements, but they all take it. They all take it. 90% of Democrats, Republicans, and independents who have Medicare say it's a good quality system. We have to find a way to expand this. If it's a Medicare buy-in, if it's a Medicare expansion, the reality is that many of us voted with great pride to support the Affordable Care Act, but we also understood that after 100 years of trying, that it wasn't a finish, it was a start, and that we would always have to improve on it. And it was a good system from which we have to build on. Negotiations like this are always about leverage, and we have tremendous leverage in the Medicare program to drive down the cost of health care and drive up the quality. A affordable health care insurance program doesn't do you any good if there's very little underlying insurance. You know, most people's problem with health insurance in this country starts when they need the insurance that they already paid too much for. So I would ask Dr. Newman, and I want to applaud the Henry J. Kaiser Family Foundation for the extraordinary work that they do in providing policy and economic analysis to help policymakers like us who are here. Your thoughts on this and the general issue?
Well, you've raised so many questions. I will say, in listening to the discussion about Medicare and sort of the issues about broadening Medicare, one of the advantages of Medicare that hasn't come up so far is that people in traditional Medicare have a broad choice of doctors and hospitals across the country. So if they move because their family moves for a job, or if they move because they want to live in Florida because it's warm, they have a choice of doctors all over the country, and that's very appealing to people who may, you know, I don't know for sure, but people may actually prefer to stay with their doctor or choose their doctor than an insurance plan. So that's one thing that I think has been sort of missing and would be particularly valuable in the proposal that you've put forward as well.
With it, I'll yield back. Thank you. Thank you.